A lot of times people will ask that they understand that salivary testing for cortisol is the gold standard, and then everything else is, inferior. Well, the fact is, there's a lot of ways that you can measure cortisol. And for example, there's been studies on serum cortisol. There's been studies on hair cortisol. But if you're trying to find the gold standard, urine testing for cortisol actually correlates very closely to salivary testing for cortisol. What's the real benefit when you're doing salivary or urinary cortisols? Well, you're able to depict the diurnal pattern and nature of the cortisol, and you can tell whether the person is, inflected with an inverted cortisol pattern, or maybe their cortisol pattern is still normal, but it's elevated, which may give you an indication of how they're metabolizing their cortisol, which could be actually an indication of, low thyroid function or high thyroid function, right? So it's important to understand that urinary cortisol testing is as accurate and correlates directly with salivary, and from my estimation, easier to collect than doing traditional salivary testing.